Oh, hi. Welcome to Andrey's Family Chiropractic, Dr. Andrey Kremenko. And if you're having lower back pain or you know somebody, your loved one, suffering from lower back pain, we're going to talk about this today. Unfortunately, you're not alone. 8 out of 10 Americans will experience lower back pain at some point in their lives. About 619 million people worldwide suffer with lower back pain, and 12 billion of US dollars in the US economy will go towards managing or treating lower back pain issues, back related surgeries. Now, the first point of contact will dictate the next course of action. If a patient goes to a medical professional, about 44% of those will result in surgical procedures. Whereas if we're looking at alternative care like chiropractic, for example, only 1 to 1.5% of those will result in surgical interventions. Now, with that said, sometimes surgery is the answer, but our goal is to prevent severe drugs, medications, and of course side effects of surgeries. Now, there are many reasons for lower back pain to occur, and of course we have sprains, strains, accidents, but oftentimes repetitive stressors are overlooked. Sitting is the new smoking, most likely you heard this. That's why our posture and our movement is crucially important. Now, our goal is going to be to find where the pain is coming from. A lot of it, like I mentioned, is going to be muscle. The muscles around the spine. Sometimes it could be imbalance in psoas muscles or inability for lower abdomen muscles to control what's going on here in the back. So a lot of seated positions will have muscular imbalances. Now, we can have, due to improper movement or accidents, traumas, repetitive stressors, the disc tissue that holds the contents of the disc gets deteriorated, and that will create bulging or herniations. That will create nerve interference on the nerves that exit the spine, and these nerves will create shooting pain, discomfort, loss of function, numbness, and tingling. So if you know anybody who's suffering with these issues, please let them see this video and help them to get the answers they're looking for. Now, of course, this could be a facet issue as well. The facets are the side joints in the spine. When these side joints are irritated due to muscular imbalance, they will get inflamed, and that will create local pain as well. So in chiropractic world, our goal is going to be to find the cause of those issues, cause of your lower back pain, and address the cause versus treating just the symptom. Now, most common cause of pain is going to be biomechanical, and in our world we call this a subluxation. It sounds like a subway station, I know, English. But what's happening is, in our spine, if we're losing proper movement, that's going to create nerve interference. And that nerve interference will create loss of function, be those muscles, ligaments, organs, sometimes entire systems. And as you can see over here, those nerves control every organ, every tissue, every cell in the body. So when the bones are not moving properly, muscles will go in spasms trying to protect the area. That will create local inflammation. And if it's not addressed properly, that will create a lot of scar tissue. And unfortunately, statistically, 5% of any acute lower back pain will become chronic lower back pain, where unfortunately people suffer with chronic lower back pain for a very long time. Now, as a chiropractor, my goal is going to be to find out where those misalignments or subluxations are, and through specific scientific chiropractic care, adjust and remove those interferences so that the brain can communicate with the body properly, relaxing these muscles and ligaments so that the body can heal better, faster. So in our office, what we're doing is we're sending people for x-rays so that we visually see where the subluxations are. We're scanning the spine. We're scanning feet, which could be another reason for back pain, chronic back pain, because what's the point of us working on the spine or pelvis or sacroiliac joints if the person is walking crooked? That's why we address the feet as needed, of course. And of course, we're looking at the assessment of the entire nervous system to make sure that the nervous system functions properly. With chiropractic adjustments, we eliminate pain better, faster, and in our office we see amazing results. So if you have lower back pain, or you know somebody who suffers from chronic lower back pain, sciatica, numbness, tingling in toes, fingers, give them this video, show them our information, give us a call, and we're excited and we're looking forward to get you out of pain so you can do whatever you want to do, whatever you love to do, better, faster. Andrey's Family Chiropractic, we're excited to serve you. Thank you.